My name's Neil Ashman. I'm leading the Barts Health outpatient response in light of the disruption that the coronavirus pandemic has caused through 2020. Firstly, just to say thank you for all of your efforts. It's been an incredibly difficult 12 weeks, but it's been striking how closely primary and secondary care have worked to keep our patients safe over this period. As you know, we have needed your help and we've been very grateful for all you've done. Barts Health usually gets around 37,000 new patient and 90,000 follow-up outpatient appointments every single month. So needing to stop patients coming up to our relatively less safe hospitals for their outpatient care was no small undertaking. From the 3rd of April, we stopped face-to-face outpatients and moved everything to an online or virtual platform. Most of this has been done by telephone, but we're moving toward a video platform at this time. We moved the booking gate to 0. We've been triaging all the referrals you have sent us, and we're very grateful for you for holding on to a number of referrals at this time. But any referral you make will be triaged and we will see in due course. We have arranged emergency contact numbers if you need urgent advice, and have opened advice and guidance on every specialty if you need a 5-day turnaround advice. We've moved consultant-to-consultant referrals to paper-free, and we've set up community diagnostics, both phlebotomy hubs and the opportunity to have medication posted to patients so that they don't need to attend. At the moment, we're still managing to review around 50% of all of our outpatients, mainly by telephone, and our aspiration is very much to move this to a video platform, much as you have been using in primary care moving forwards.
Hello, I'm Roberto Tamsangwan. I'm the Well Outpatient Transformation Clinical Lead. On behalf of what you've done for primary care, I'm incredibly grateful. We've stood up to the challenge of putting in new ways of working overnight. We're following total triage, increasing digital access for patients. But most importantly for outpatients, I know that across the system we're peer reviewing our referrals with colleagues before submitting them to the Trust to try to reduce the number of inappropriate referrals. We are making use of advice and guidance, and we're supporting hospital colleagues to reduce any inappropriate referrals. I have my colleague Annie Carlin, who is the Programme Director for the Outpatient Transformation across the Well CCGs and Barts Health. One of the questions I'm sure you all have is how to refer suspected cancers into the hospital. And another question you may have is how to refer routine referrals into outpatients.
So for routine referrals, we're asking GPs to please peer review your referrals with your colleagues before sending them through. You can also ask for specialist advice using advice and guidance routes. And if you need to make a referral, please do so. It's really important that we hold all of the referrals on a single waiting list so that they can be triaged and clinically prioritised for a virtual appointment. For urgent referrals, please use the hospital switchboards and you can get through to a specialist, or you can also use the advice and guidance channel. And for emergency and 2-week waits, please continue to use the existing pathways and guidelines for those referrals.
There are some instances of consultants asking GPs to prescribe hospital-only medications or request pathology tests or imaging on their behalf after remote or virtual consultations. Here's the guidance on this.
We know that the pace of change over the last few months has meant that there are a few issues that we need to iron out. We're listening to GPs and we're speaking with our colleagues, and we're very clear with consultants that they should not be asking GPs to order specialist tests. We know that you don't have access to many of these and that you're also really busy with your own patients and you can't take on these additional burdens. Going forward, we're also setting up a primary care insights group with GP representatives across Well to provide input and gather views to input into the COVID outpatients group.
For the foreseeable future, outpatients is going to be about safety, keeping vulnerable and shielded patients as safe as we possibly can. But what might a future outpatient service look like in East London? Ideally, we'll be seeing fewer than the 1.5 million people we currently bring to outpatients at this time. Ideally, many of the pathways that patients need will be delivered in the community. From MSK to gynae to ENT to the successes we're starting to see with teledermatology and dermatoscope use in early diagnostics. I'd like to believe that we'll have closer contact with primary care at the interface between referrals, either through advice and guidance or a similar product. And we think that we're going to be seeing most of our patients virtually, virtual by default, using one of the expectations that the NHS has of our recovery after the pandemic. We'd like to believe that most diagnostics will be done in the community. You can have your blood tests local to your home, you can collect drug prescriptions close to your home, and if you need an imaging test, that will be directly bookable in the community. We think there'll be more patient information. We'd like to believe there'll be peer support available to patients through the video platforms we'll be using. One of the things we're really alive to, particularly in East London, is a need to avoid inequality. We're determined not to bring new inequalities into a more tech-savvy outpatient environment. And above and beyond this all, really, it's a hope that we'll work more closely together, that we'll look after long-term conditions in a more coordinated, joined-up fashion, both with nursing colleagues, with therapists, with the patients themselves, with their charities, and with you in primary care.